Sorry, I got your last name, Ilya. Yes.
It's terrible. Istvan.
Istvan. Everyone knows Istvan. That makes a difference.
It's a Hungarian.
Yeah.
Ulhei.
Ulhei. Okay, thank you. And we have Maya. But Adriano, the floor is yours.
Okay. Okay. Hello, everyone. Dear all, ladies and gentlemen, dear friends, here in this room and online at the YouTube channel. I want to give the special thanks to Istvan. I don't want to try the last name. Making this possible, and also to Anna and Christoph assisting us in organization this all. I feel hugely privileged to be here with you. So thanks to you all taking the effort coming to Brussels, the European heart of democracy. It also great thanks to Istvan inviting our members and organization to this venue and platform. I also want to thank Maya Matthews to be here and supporting us all. With this event, we also experienced the recognition of the health professionals in the nursing and care domain and its specializations and levels of expertise to become visible and above all, present. And it was about time, because over the past years, we have been too busy in dealing with the COVID crisis and also the aftermath towards preparedness. And while we are here, it also is in line with other special momentum. And at this very day, it's a global mental health day as well today. Our purpose here is to explain what we do and what we are, but ESNO is not only here to promote our organization, but rather to assist policymakers in making informed decisions and to ensure that they do not overlook critical elements that deserve their attention at the early stage. Furthermore, we seek inspiration from the policy domain to guide us in charting a new directions. We cannot afford to remain within our comfort zones. We have to explore something more. We experience formidable health challenges on the horizon, including nursing shortage in the health workforce, challenging working conditions, the need for educational reforms, the evolving landscape of job roles, the interplay between public health and private equity interests, budgetary constraints impacting healthcare sustainability, new environmental demands to address climate change, and finally, the issue of salaries. Across most European regions, healthcare professionals find themselves at the lower end at the pay scale, despite being among the most trusted in their respective fields. This glaring disparity must be disheartening. However, the majority of us, both present here and those joining us remotely, share a common ethos when faced this adversity. We don't ask why me, but rather try me. Today, we are having our first meeting in the European Parliament with the expectation that we are going to be here at least once a year. With this, we start a tradition, but also share our expertise, knowledge, insights, and we have to contribute to the greater challenges we, as members of the European civil society experience and where we, as professionals in the nursing care domain, wish contribute. During the day, we are going to hear a lot of sessions in speaking slots, and we also hope that we are able to catch time for questions. Maybe we are time limited, but we will try to assure discussion as well. With these last sentences, I ask Bear, in his role as a moderator, guiding us throughout the afternoon. Later, I will come back with some elaborations on the report as a result of the outcome of the World Cafe and ESNO Congress. I wish you all fruitful event, and again, so highly appreciated to join is in Brussels and those at home tuning with us for this special occasion. Thank you, and I wish you a nice event.
Thank you, Adriano. For me, there's not much to say. Lady moderator is always invited to do some housekeeping words. You have received a brochure And that includes the program, also already the declaration, also a book about the people of ESNO, because you only know a very few, but you must realize there's so many people behind it. And I'm looking, for example, at Elfie, our photographer. She's also a nurse. So I'm really pleased to have Elfie with us. And we also have an invite for the Congress next year. For the event organization, I really thank the team of Health First Europe just assisting us in this process. I also thank Joris and Katarina from Fiatris to support us in this event. Thank Istvan, and indeed this event is recorded. After the event, there will be a portal opened for the endorsement on the declaration. There will be some images in the hall after the event. So after the event, we have to move out, but don't go away. Also because there's a drink at Quartier Leopold. So I would like now to give the floor to Istvan.
Thank you so much, Bear. It is my pleasure to be your host. I'm really appreciate. Thank you so much. Maybe there are some guests who has the first experience in this house. This is the European Plaza. Sometimes I call it Plaza because we have so many things here. The members of the parliament arrive and stay here 2, 3, 4 days per week. And from the early morning till the late night, we are here. So we have everything here. But the most important minutes always for me when I have guests. Guests from Hungary, for example, from my home country, or guests from those industries or those issues which are very close to my heart. And you are from the health service. You work for our families, our relatives, our societies. That's why when I got the information about this event, I immediately told to Zoltán, to my excellent advisor and colleague, to try to be the host today, because it's very close to my daily life and my heart. You have to know that my parents are doctors, so all my life was around the house structures. My father was a family doctor, and he had excellent colleagues, nurses, who helped his job. My mother was a general manager of general manager of one hospital, and a pathologist. So I learned a lot about the public service, health service structures. And I'm one of the initiators of the European Health Union initiative. I started it before the pandemic, not because of the pandemic, before that, because my main aim is to have one minimum quality standard for all our European citizens in all the European member states, in all small corners of the European Union. Because you know very well how big differences we have when our societies would like to have, when they need your support, your service. You would like to do the best, but several places, regions in Europe, we don't have enough colleagues, we don't have enough hospitals, we don't have enough money to finance the public health services. And when we are talking about the nurses, I just wanted to tell this family story because I wanted to give you that feeling. I know very well what does it mean to serve as a nurse. So that's why I'm here as a host. So thank you so much. And although in this house, the voices of the members of the European Parliament may be diverse, from extreme right till the left, from Greens, from Liberals. Maybe we have different ideas about the public health policies and structures. Sometimes we have conflicts, but I can safely say that we appreciate what you have done over the past years. It does not only deserve a big applause, but also our deep respect. You are the heroes among us. Of course, I'm thinking about the traditional pandemic situation. At the occasion, I would like to mark my support to the president of the ESNO, Adriano, in the organization of a commemorative event early next year for these healthcare workers who gave their lives to save ours. But as today, this afternoon, we are here, and this is great momentum for me personally. I would like to underline the diversity of specializations in the nursing and care domain. We overlook the healthcare assistants too often, why there would be no care without them. And we should echo this everywhere we can, that the disproportional migration of health workers within the EU has resulted in a workforce crisis, and several member states face staff shortages, putting health system sustainability at risk, which is not good at all. All EU member states are suffering from shortages, not only the Eastern European countries, but I get the same, for example, from Italy or from other countries. So I have called for a European Health Union, starting from the development of European quality standards in health and up to financing policies that guarantee fair access to health for everyone, not only the rich European citizens, all the others, because sometimes we have that message from third countries: you are happy, you are in safe because you are Europeans. But we know very well we have so many problems here in the European Union, and one of them is the public health services. In my learning, I truly understood that what the differentials between different nursing specializations are. For many of us, it seems clear that a graduated engineer is not just an engineer. It makes a great difference if I speak about an engineer in aviation or in the field of mining, for example. And this is the same when we are talking about the health services and when we are talking about the nurses. Nurses can't just switch from one ward to the other. They are highly specialized professionals with a very particular set of skills. During the COVID pandemic, many nurses found themselves in absurd situations, being relocated to stations that were not their specialties, and they couldn't be helpful enough. But also having their responsibility engaged in such situations can be very distressing. Here, I would also like to mention the students who were sent to intensive care units and put into situations only an experienced person should be in. It happened in all our member states. No wonder that so many nurse students left their studies, and we still experience a high turnover in our nursing staffs. So I know that ESNO is extremely motivated and proactive in the many programs of the European Commission. This all related to the retention and well-being of nurses and making their voice be heard. This has been done namely by the establishment of the nursing pool, a platform for engagement in your wonderful nursing community. And I would like to mention some other things. For example, I would like today to welcome the nurses from all European regions who made the effort to take a day off, as many are not supported to do this and are taking part in this meeting. The learnings of today's discussion, as well as your report, will feed me with insights to share with my many colleagues. Of course, my door is open for the associations and also for you personally. And my last sentence, and maybe this is the most important, I would like to thank to Bear, to Hannah, Adriano, Maya, to be here, and thank you for your efforts. So thank you so much.
Thank you, Istvan. I directly go to Maya. We must be ready yesterday and the week before. So please go ahead. Just what's up? What's on your mind?
Thank you very much, and thank you, Istvan, for hosting this and inviting me, and of course to Bear and Adriano and the whole team. It's always very exciting for me to meet with ESNO because I know that you always come up with new ideas. And when I heard that you were bringing a whole group of nurses from all across Europe, I was the first one to say, yes, I will be there. And I will be there because I guess I will share a little bit my personal background and why I'm here working in health in the Commission for almost 16 years. When I first started working in public health, it was more about, I was very interested in how diseases traveled across borders, how people behaved with diseases. But then I realized that you have to look at the system that's treating these diseases, and you have to look at the people working in the system. So for me, I've always been very interested in the whole process of health systems. And that's why I didn't become a nurse, because actually I was very interested at one stage to become a nurse, but I wanted to be able, I was interested in looking at the processes in health systems. And also when I studied public health, it was at a time, probably 30 years ago now, when there was great hope that we were going to change the old-fashioned way that health was delivered, focusing more on hospitals, focusing on infectious diseases, focusing on acute care, and that we were going to do a lot about prevention, that we were going to move out into primary care, that you would have different tasks for different professionals. And the whole time, I've still been talking about prevention and the importance of different roles and talking about different competencies. And as you said, it's about skill sharing, right? But I see that we're kind of still stuck. We're stuck using the old rhetoric. So today is really important for me because I would like to hear from you, where you see the learnings, where you see any change. Today, as Bear said, there was a big meeting in the European Commission about mental health. I think that it's not a coincidence that you're here also on that day, because we've seen that physical and mental health have to go together. I would also add environmental health. I think that's going to be something that we'll see a lot more about in the next few years. But the fact that mental health should be on the same level as physical health, and how are nurses approaching this issue, because you can't divide the physical and the mental. I think it's very much integrated. And I just came from a conference about digital health, and here I'm also very interested to hear from you, your views on the digitalization of health systems, because at the moment I think we can all agree that we're going through a complete transformation of the health system. The health system as we know it is not sustainable anymore. There are figures coming from the Netherlands saying that if we actually met all the healthcare demands just in the Netherlands, it would mean that 1 in 3 workers would be working in the health sector. Now just think about what that means. Do you think that's actually feasible? Is that something that we actually want our society to be in? So it's not just about the retention and the recruitment. It's also about looking at how we can change health system completely. And I firmly believe that people working in the health system are best placed, sometimes also the most resistant, let's be honest, that many people working there, you don't like change, but I think change can only come from within. And so that's why it's fantastic that you've made the effort to come to Brussels, to meet with us. I will give you just a little bit of a rundown. I thought it might be interesting for you to hear the different building blocks of the health union that we're working on. These are different initiatives where we felt with the European Parliament and the Council of Ministers that these were issues that were of broad interest to the European level and where there could be some added value at the European level. So one of the issues is this European health data space, which we are currently negotiating. This is the first ever ambitious plan to try to link data that all individuals in Europe will be able to have access to their own medical records, and they will be able to travel with them. And if they need, like, let's say we're in Belgium and we're going to Italy and we have an accident in Italy, you see a doctor or nurse in Italy, they will be able to read your medical records in their language, and they will be able to see what your health issues are. So that's something that we're working on. But linked to that as well is the fact that data now has become such a source of innovation, of interest. So as part of this European health data space, we are also creating a system where researchers and policymakers can actually apply to get data from huge data sources. We now have, as I said, digitalization at our fingertips, and this will hopefully provide as well more research, innovation, not just for new treatments, but also, as I said, the process innovations, how things are operating. Another initiative is the Europe's Beating Cancer Plan. And this was, the idea behind this was really to put all the expertise and funding rally around one disease topic, but bringing together all of the different parts of Europe, all the expertise to work and to address cancer from all of the different pathways, from prevention, diagnosis, treatment, and the aftercare. Because now, thank goodness, many people are surviving cancer, but actually the social and economic aspects of reintegrating into life after having been ill for many months is also problematic. These are just two examples of areas where I think that from the nurse's perspective would be of interest to you to see how we're doing this. And I think that the other message I wanted to bring forward is that, as Istvan said, we're very, very aware of the very difficult conditions that many nurses and the health workforce in general is dealing with across Europe and globally, to be honest. We have figures. Just recently, my colleagues informed me that there was a European Social Development Report which asked asked different professions about their lives. And the job strain for nurses was 60%, twice the EU average. So the EU average in terms of like how stressful, straining do you feel your job was 30%. And in the nurses, it was 60%. 69% of nurses said that they felt unsafe in their working environment. And 40% of nurses felt that they're that they were not paid fairly in relation to the amount of work they did. So these are very dramatic and strong messages. At the moment, we have a lot of ad hoc information. What we need is more data. Bear knows this. I always said, give us the data, because as civil servants, then we can present that to the politicians. So give us the data, give us your feedback on how things are going, not only the negative. I think it's also very important to identify good areas where you think, innovation for positive can be made. And then we will see as a civil servant, we work on different areas, we meet people, and hopefully through that we can identify areas that we could propose for working further. But as I said, there's already a lot on the table. The pandemic, we knew about the sustainability of health systems and how vulnerable they were in many areas before the pandemic. But the pandemic just exacerbated this and brought it to the attention of everyone. So I think that we've done a lot. And so my big message to you is to welcome you and to also please give us feedback, give us data, and also share with us your views and dreams and hopes. Thank you.
Thank you very much. And I directly go to Blerina. I'm really proud that she made it. And also what we try to do is to be specific and also to try to be in the frame of the time. But I'm really pleased that I have, well, this is a personal message, because here in the Brussels environment, if you ask a nurse, well, takes better. If we want to have a doctor, better. And they're all from the same regions. So it's very interesting for us to have also the Balkan regions. And there's so much great developments coming on. So I'm really, really very pleased to have you with us.
Thank you, Ber. Thank you, Professor Alexandra, for this possibility for speaking this event for further nursing in the Parliament. I am Blerina. I am president of Albania Order of Nurse, 12 years working nursing, 11 years director of a social center. Since 2019, I am a president of Albania Order of Nurse. I work in Tirana, but I live in the Elbasan, in the small historical center and the castle neighborhood. From the window of my room, I can see the bell tower for 2 churches. From the window of my kitchen, I can see the minaret of 2 mosques. Religious tolerance is one of our national values for my nationality. Albanian Order of Nurse is a public entity non-budgetary, represent the common interest of the professionals of the nurse, midwife, physiotherapist, laboratory technician, imaging technician, speech therapist. It's regulate and the relation between for the benefit of the public. Mission for Albanian Order of Nurses maintain the standards adopted by the Ministry of Health in the exercise of the profession, overseeing and observance to the code of ethics, protecting patient and the public from the misuse of the professions. Responsibility of order. Perform the register of members and the register and update it. Oversize the implementation of professional duty. Cooperate for the development professional standards. Plans, designs, and develop vocation training programs. Conduct various training in the field of continuing education. Guarantee that members of the order will fulfill recertification program obligation. Education in Albania is a private and a public. Bachelor for healthcare professions in 3 years, Master of Science in 2 years, Master Professionals in 1 year, and Doctorate PhD. Our work is nurses' competence, professional profile, and new professional deontology code. Our work is strategy of order, the new statute, and scientific journal. Our focus is continuing education, strong collaboration with the Minister of Health, high standards in professional practice. What we need? My colleague and I think that it's time to work in specialization program in nursing. Recognition of diploma and permission to practice of the profession, advanced practice nurse, implementation in European Union directive and clinical practice in nursing education. Thank you.
This is only a very little bit what Verena said, what she's doing. When I was Googling, I also see that you have conference coming up with the countries in your region.
Yes.
And it's very heartwarming that there are so many activities also in your region, so also cross-border. So I think it's very crucial that from the west part of the European Union and the east part, there's a lot of good collaboration, because it's also what the concern is of the MEPs and the European Commission is a mobility out of stress of our salaries. So we have to have these career opportunities. But I really hope that we're going to learn more from your organization. Thank you very much.
Thank you.
Yeah. Okay. Now we are going more to the contextual things. So we're going to have some speaking slots of Danielle Leeuwald, from Pascal Roth, and some more. But before going into the real nursing, I wanted to share you 2 slides. And first of all, that we have a new member coming in, and because we have a lot of diversity, and I'm really pleased to announce that we also have the European Federation of the Education and Nursing Science also stepped in as a member just last week, and we have Cécile Dury also with us. Okay, and I want to bring you in contact, because she just texted me, can you bring me in contact with Maya? So now you already know your face. This is how digital works, huh? Okay, The next one is that the nurse students also have arrived as a member, and this is very important. The next one is that we have two speakers who say, well, I want to have a slot. And these are Vanessa and Olga. And I told them, you only got a few minutes, but you have brought something special. And after your session, we're going to the advanced nurse practitioners. But history and nursing is not just a task. Just explain a little bit about your initiative, and really pleased to have you here with us.
Okay. Good afternoon, and thank you very much for inviting us to talk about our project, Invisible Nurses. But before we start, I would like to ask you a question. Don't worry, it's a very easy question. I'm sure everybody knows this device. It is a colostomy bag. But can anyone in this room please tell me the name of the person who invented it? Can you tell me the inventor's name? No, this is very interesting because the person who invented the colostomy bag was a nurse. And what if I told you that a nurse invented the baby carrier and the portable oxygen backpack? Did you know? Did you know that the invention of the syringe is also due to a nurse? Many incredible nurses have been made invisible throughout history. Invisible Nurses is a project that aims to make these and other nurses visible, who for centuries made inventions, patents, and other significant contributions to the science and to the society, but do not appear in the history books of nursing, and they are unknown. We have gathered the stories of 14 invisible nurses in this picture book published by Penguin Random House. And what next, Olga?
Hi, everyone. Now we are working in two new projects. The first one is Invisible Nurses, Latin America and Caribbean. We are working with 15 countries, and maybe, if we are lucky, maybe more. And we continue working in a second book to make them, the nurses, visible, because there are more invisible nurses than we imagine. Ladies and gentlemen, this colostomy bag that allows any of us sit here today and to lead a normal life was invented by Elise Sorensen. Is a Danish nurse, and we hope she never be again invisible. Thank you.
Oh, sorry. Here's Adriano, who is going to say some words on the report, and then we're going to Daniela.
Okay, hello everyone. First of all, I didn't know what to expect about this history. I expected as you something maybe boring, but great thing. Thank you very much for this. I think you did a great job for nursing. Thank you once again. And as Maya said earlier, that whenever we come, we are getting a new idea, and this ESNO declaration, which we'll present at the end of this event, started in April because we wanted to invent and not have just event usual, and we tried to implement the World Cafe format in ESNO Congress. And we have first one this year in April. And we were so happy after it because we have time to join with the people. We were so enthusiastic to share ideas, share knowledge during the crossing the tables, and we had enough time to meet each other. It was not only a nurses, it was a healthcare allies, it was partners from our partner organization. And we followed up the same thing in the June prior the ESNO congresses. And after that, we gathered a lot of inputs from different people. And really we're getting other perspective when we get so much information from so many people. And it was great. We created consultations with the help of the Health First Europe, and we created the report. You have it. And we created ESNO declaration, which will be presented at the end of this event. And we are really proud, and we want to thank to all of you who participated in our events, because all of your participation give us enough energy and enough information to create this first step. And after it, of course, we have to follow our declaration. But for at the first time, we created such an important document for the future, and it's a part of our campaign Caring for Nurses and our campaign Decade of the Specialist Nurse 2020-2030. And yes, thank you very much for everything.
As I understand, this is a process which is going on. So it's not going to end here. It's just going on. This is going on. So now is the floor to Daniela Leeuwald. And I'm really pleased that we have started this collaboration with European specialist nurses, the advanced nurse practitioners, and also what Istvan mentioned, the healthcare assistants. So there's a whole range, and you have been able just to connect a lot of dots. And you're going to show us how dots are connected, and also maybe related to this sensitive topic on prescribing. So Daniela, thank you, and the floor is yours.
Thank you very much. I'm just going to switch this on here for 1 second again. So thank you very much. Yes, my name is Dr. Daniela Leeuwald, and I'm, apart from many other roles that you can see on the slides, I'm representing today the International Council of Nurses, Nurse Practitioner, Advanced Practice Nurse Network, which I'm chairing. And I am a former nurse practitioner in cardiothoracic, so in heart-lung surgery, and I am a former intensive care nurse. I'm very happy to be here today and talk about advanced practice nursing, the role, and nurse prescribing as part of the role. I'm starting off, next slide, please. I'm starting off with using a bunch of flowers as an analogy, I suppose, to demonstrate one of the changes that you were asking for to highlight today. In the past, the nursing workforce was very much a nursing workforce of general nurses with some specialist nurses. Like myself, I'm an intensive care nurse, or there could be operating theatre nurse. Now today you see the bunch of flowers has changed a bit. It has become more colourful and the proportion has slightly changed. We have way more specialist nurses. There's dementia care, there's palliative care, there's community care, there's mental health care, intellectual disability. There's so many different roles nowadays, all very specialised, and it has been said at the beginning by Istvan as well, that has become a very specialised profession, and that's very true. But a new change as well, particularly in Europe, is that we have advanced practice nursing. And that is in Europe fairly new. And this is something that, with regard to the global network that I'm chairing, is something that we really want to bring forward within Europe. We have it in some countries, but in terms of legislation and the role being fully defined and the practice being clear, we are still at the very beginning, I would say. It should really form 2 to 6% of the nursing workforce. And it means that this nurse steps out of the general working force to work at a different level of practice, where she can provide a full episode of care that includes nursing, but it reaches over into medicine, and that includes prescribing. So why is that important? It is important because it's important to patients. It just cannot be nowadays that we have a situation where frequently, and we have that data, where frequently patients in pain, pain levels of 8 to 10, very high pain levels, are waiting on average 6 hours to just get a painkiller. And we're talking about maybe the 2 paracetamol that all of us could buy in a pharmacy right now, but the nurse cannot prescribe it to their patients. Now, how that can be nowadays, I don't know. And that needs to be changed. And if you're saying, I suppose, and I guess that's a message for Istvan and all of his colleagues, if you're saying like the nurses are the heroes, I would say you can become our heroes and also our patients' heroes if you can open the discussion around prescribing for nurses and include them in this legislation. That is what our patients and what we need. Our patients also shouldn't have to wait for chronic care that they deserve, if that's COPD, if that's pain management, if that's diabetes, hypertension, chronic heart failure, anything like that. The waiting times are long in many European countries, and they don't need to be. It's a service issue, as you were saying, a system issue, and that's what we need to work on. I totally agree with you on that. Patients shouldn't be waiting for shouldn't be waiting for prescriptions on discharge. They should be there. There's no point in waiting for the whole day to just get that prescription. And talking about digital, that can be done digitally. You know, we shouldn't have to wait for these things nowadays. There's a lot of things we could do. And there shouldn't be lack of prescriptions to cover surgical wards where the surgeon, quite rightly, is in theater. That's what they're supposed to be. But on the wards, the patient should get their prescription when they need it. And when the condition change, if a patient after heart surgery goes into atrial fibrillation, they should have an advanced nurse looking after them. So that would be our claim, I suppose. So it's about timely care. It's about access to care. Can you just press the button there a couple of times? Yes, timely care, access to care. It's about efficient services and enhanced patient outcomes. Next slide, please. Just checking my time. So just to say, there is really a progression in nursing. When we talk about nursing, quite often we talk about nursing, this big thing. But really, we can break this down, and that's really important to us. So there's a progression. So as a general nurse, I do my training. I would have done my training about 3 to 4 years, and that could be diploma, hospital-based diploma, could be a degree, depending on which country you're in, and that's absolutely fine. So that includes anatomy, physiology, pathophysiology, pharmacology, supervised practice, so the actual training, and that gives me basic clinical competencies to practice safely and competently as a nurse. And going on, once I'm at that stage, I might want to work in the intensive care unit like myself, looking and saying, oh, that's what I want to do. But that requires me to continue the education and develop my competencies. So further 1 or 2 years of a higher diploma in the specialized area to develop specialized competency, clinical competencies. As an advanced nurse, I have to do all of these things, as you can see on the slide. I was trying to highlight the colors. I hope that works. I have to do another 2 years of a master's degree. That's the entry level recognized or recommended by the ICN and globally accepted to practice at an advanced nursing level. And that includes advanced anatomy, physiology, pathophysiology, advanced pharmacology, supervised practice, and advanced and shared medical clinical competencies. And that includes physical assessment, history taking, diagnostics, ordering an X-ray, looking at the X-rays. Is there a fracture? Is there no fracture? What's the treatment? Do the treatment. And that also might require a prescription. So it's a full episode of care that these nurses can carry out. And there's plenty of data worldwide to show that this role works very efficiently. And it's comparable with medical practitioners. And it really is all about sharing to enable the care being given in a timely fashion to patients. And an example of nurse prescribing, I suppose, from Ireland is that all advanced nurse practitioners in Ireland have to be, by law, also registered nurse prescribers. A lot of nurses will have at that level a PhD, but the doctorate in nursing practice is coming slowly across the sea from America. So it is going to be legislation there in 2025 as entry level. So I'm just saying to Europe, hello, it's coming. So just be aware. The ICN network has been involved in writing guidelines for prescriptive authority for nurses. And I just want to mention, because there's usually an assumption that it has to be straight away independent prescribing. And there are 3 levels. So an advanced nurse practitioner should be an independent prescriber, which means that she or he diagnoses or assesses diagnosis and writes a prescription accordingly. Now, at a different level, there could be a dependent prescriber, where there is an independent prescriber first. That could be a medical practitioner or an advanced nurse practitioner who actually diagnoses and kind of gives direction. And then delegates the prescription to the dependent prescriber, who could be maybe a different level of nurse, for example. And prescribing by protocol works really well in chronic diseases, where you have a pathway for COPD, for example, or diabetes, where it's very clear what the next step is in the escalation of your prescription. So that's another way how that can be managed, and it should always be should always come together with a service level agreement, where it's agreed within the organization how that's actually going to pan out and how that's actually going to work. So that's quite helpful as well. Just want to make sure. So just to, sorry, next slide, please. Thank you. Yes. So just wanted to mention, I suppose, in terms of the network, and the ICN network is really there to promote the role. And we have, just on the slide, I suppose I'm just outlining, in the last kind of 3 to 5 years, we have been involved in several, conferences. We run our own conference every 2 years, peer review presentations. We have been involved in books, mentoring kind of different countries, including Hungary, by the way, for advanced nursing as well. And the ICN guidelines, which include prescribing. So what we would like to see is that if there's any discussion around advanced nursing within Europe, we really would like to hear from you, and we want to be involved. So I've put the email on there again, and please do let us know. We have certainly a huge interest to move this forward within Europe, and we would love to collaborate. So thank you very much.
Yeah.
I just wanted to quickly ask you a question. So you said that it's in Europe, it's coming, because I know, I mean, when I studied it, it was very much in the US now, advanced nursing, that's like a given, right? Do you have a list of like which countries in Europe it's?
I can tell you them straight out. It's very simple in Europe.
Okay.
There's Ireland, which has a very strong regulation, educational framework and practice. There's the UK, which is not very strong in regulation, but very strong in practice. And they actually have advanced clinical practice, which is not just nursing, it's nursing, pharmacology, occupational therapy, physiotherapy, all kind of roles that are in clinical practice. Then there's Finland coming newly on board, and then there's the Netherlands, which is here, which are very strong too. And after that, there's a lot of countries within Europe who are on the pathway in its infancy, where regulation a huge issue, and we will hear about that later on.
Wow, short question, straightforward answer, and very efficient. Really, really well done. Then I'd like to give the floor to Alessandro. And Alessandro, he is one of our board members, but also the leading person to connecting us to really new opportunities. And he's an educator, and he is also very strong, passionate just to bring the right people to the right spot. So that's also the relation why Blerina got here, through the contact of Alessandro, and he has a very, very wide view on the nursing. So Alessandro, please go ahead with your wordings.
Thank you, Ber, and thank you all for coming over here. And dear esteemed members of the European Parliament, Maya and Istvan, I'm truly honored to be with you all today in the heart of Brussels, surrounded by so many dedicated and passionate colleagues, to discuss a topic of great significance to us all, the relevance of specialist nursing challenges and concerning harmonization of education, certification, and recognition of in the European context. And, my discourse rolls out in these 3 tenets, these 3 great issues. The first issue is education, certification. The second issue is certification. The third issue is recognition of the titles of advanced practice nurses or specialist nurses in advanced practice. But, I would like to explain to you my personal journey at the European level. I started here to be in these premises in the early 2000s. and we initiated everything with my national regulatory authority from Italy originally, and with other 3 countries, United Kingdom at the time was in the EU, Ireland and Spain. We initiated a kind of group of regulatory authority at national level to regulate or to have some advice, for nurses and pediatric nurses, midwives. It depends by the regulatory authority at the European level. So, unfortunately, the organization still exists, but it's not so powerful anymore. And many of the original countries got out of the organization. Anyhow, the same issues and challenges that were present at those times are still here and very present. And the first of these issues is education. Nursing education, as you probably know, is different in many different European countries. And some of these countries is still at vocational level. And according to me and to us as ESNO, is unacceptable, for the quality of care and for the patient safety in 2023. Nursing education instills a deep understanding of patients' needs, grounded in data and knowledge. And I was very happy when Bear was mentioning, or some other colleague, that we had to base our discourses on data. And we are going to provide data because, Bear, we are running, a big systematic review on different European countries on advanced practice nursing. And, this is one issue that is still very present, and we have to work all together to advance education in all European countries to guarantee, a good quality of care to all EU citizens. We, as nurse specialists, cannot afford to allow ourselves to be driven by heterogeneous educational pathways at basic and advanced levels, and consequently insufficient care practices, decisions with no impact, or misjudgments leading to unsafe patients' care. The second issue is linked to the harmonization of recognition of the nurses' protected titles. This is another big challenge that, regulation is the term used for the legislative process in which the health professions are governed to determine the standards for which the professions are registered in a manner that protects the public. The framework for regulation is defined and mandatory, or I should say, should be defined and mandatory for all countries, but sometimes it's not like that. In this framework, ESNO proposes a table, a regulation network, to provide an opportunity for different institutions involved in specialism in nursing and other interested parties to debate and discuss critical issues in regulation and provide an update at regular intervals about the world of regulation of advanced practice. As Daniela Lewald was stating before, there are some countries who are advanced in specialism in nursing, advanced practice, but not so many also of these countries have got regulation. And she was mentioning Ireland and the Netherlands, but all the other countries are still struggling to regulate advanced practice. And this is another thing to be discussed, at least. And, I'm working daily with nursing students from Italy now, especially from Rome and Sicily. And I'm very proud of that. But these new arrivals, these students, and, aspire to enjoy their work and make a lifelong commitment to their noble profession, nursing. Yet, as mentor of these students, I cannot ignore the concerns that weigh on their minds. We got many problems to retain students, to enroll students in the nursing profession, and because in these were very, very harsh years, and the aggression received during COVID, the relentless time pressure and the ever-increasing responsibilities of nurses, in our case, accompanied by low salaries, are hindering, healthcare systems in general. This worst-case scenario is when these passionate individuals, nurses, but also the students at the end of their pathway, they are in the loop of recognition of titles at the European level. And this is another great issue. For this reason, I would recommend, to have this table to discuss some key tenets to be debated. Continuing competence revalidation and different approaches being used for specialists in nursing. Development of regulatory jurisdiction accreditation models for specialist nurses. Education, accreditation, and transition to practice for specialist nurses. Exploration of how to apply proportionate regulation. Ethics, ethical practice, and regulation. Fitness for practice, conduct, and competence issues. Governance, nature of the regulator, character of the board, membership, and accountability of the board. Interdisciplinary issues. Licensing, credentialing, recognition of titles, relationships between countries, mechanism for recognition of nursing specializations, promotion of standards of education and contents of curricula across different jurisdictions, regulation of advanced practice roles, regulatory collaborations, research pertinent to the regulation of specialist nurses, unethical, illegal, and dangerous practices. So we can launch, a table on that. And then, because I have to come to an end to this discussion, unfortunately, the path forward. In the years to come, ESNO, in collaboration with the OVECA, Be Well, and the esteemed European institution, have worked tirelessly to establish a credible system. And I would like to use this occasion to invite you all our specialist nurses, but also representatives from higher education institutes and different organizations to connect with us. But I would also like to invite all of you to our annual Congress that next year will be held in Milan, 2024, 5th, 7th of June. This event will address all the issues that we are mentioning today, and we will kick the Congress off with a special event titled Hacking the Health Workforce Problem. Are you ready for the challenge? And so I invite all of you to engage in dialogue with nurses, specialist nurses, regulators, nurse directors, and different stakeholders and governmental authorities. And in conclusion, I hope this event will begin a new tradition, as was mentioned before by our President Adriano, of meaningful discussion and collaboration among us. Thanks.
Thank you, Alessandro, and it's good to hear also this regulatory aspect. That's also a part of the specialist nurses. So we're going from history to regulatory, and I'm really pleased now to invite Pascal for your information. He is the first president of ESNO, also the founding father. So I'm really pleased to see him here, and he's going to talk about the specialization of anesthesia nurses. So you're very passionate, and your challenge will be also to be in time. Thank you very much.
Thank you, Bear. And I will correct you. You used the wording anesthesia nurse is what I disagree with. We are nurse anesthetist, and it's very important because we have the two roles together. And most of the time there is a kind of confusion in the people. They are thinking to nurses working in anesthesia. No, we are nurse and anesthetist together. And this is important. And when we were referring to invisibility of some nurses, it's maybe a specialty that is quite invisible. And we could experience also in the past, even the hospital directors don't know exactly what a nurse anesthetist is doing every day in the OR. The first slide, please. So when, yes, there was a slide before, but yes, please. The first one, yeah. When we are referring to nurse anesthesia, we are referring to a nursing specialty, but we're also referring to advanced practice. And if we take as an example the advanced practice nursing that was born in the US many years ago, and the first advanced practice nurses recognized were the nurse midwife and the nurse anesthetist. And then we can also refer to intermediate health profession. That is something that was raised here in the EU. There were many papers referring to the needs for developing some intermediate health professions, and nursing specialties in advanced practice are typically what could be called intermediate health professions. Next slide, please. In terms of education, if we are referring to the nurse anesthetist educations, we are first next to general care nursing with a bachelor level with 180 ECTS. And this is on this only level that is recognized by regulation at the EU level. But now we are referring to more. Then before becoming a nurse anesthetist, you need to have at least 1 or 2 years of clinical experience in acute care. So the nurses, after this 1 or 2 years, get already some really experience in taking care of patients in acute situations. And then you have an entry selection for entering a nurse anesthesia program that is lasting 2 years. And it's when it's really well recognized and really regulated, it is recognized as a master's level. So if you see the content of the 2 years of education, in addition to this clinical experience before entering the program, it's composed of advanced pharmacology, advanced physiology, anesthesia techniques, different type of surgery, different type of patients, clinical training in situation as well. When we are referring to advanced pharmacology, this means that the nurse anesthetists are trained in a different medicine used for in anesthesia, with the doses, with everything about it. So they are trained and ready for prescribing their own what they are themselves using. And altogether, if we go to the next, it makes 6 or 7 years altogether. So we are far from the 3 years of basic nursing education. We are far above, but far beyond. Next, please. So what is the definition of a nurse anesthetist? Last year, 2 years ago, we defined with the International Council of Nurse, we defined some guidelines for nurse anesthetists in advanced practice nurse, as we were referring before. And this is a nurse who has the knowledge, skills, and competencies to provide individualized care in anesthesia, pain management, and related anesthesia services to patients across the lifespan whose health status may range from healthy through all levels of acuity, including immediate, severe, of the life-threatening illnesses of injury. So this is the part of where the nurse anesthetists are really involved. So sometimes they are just, we are in the OR and then we don't know what they are really doing. But sometimes they're also used for their expertise in pain management and also for the airway management. And they are, for the technical skill, they are also known for helping in airway and intubation and so on. And during the COVID epidemiology, they are being very well used for this type of taking charge of patients. Next, please. What is the role? It's a continuing management of anesthesia and patient according to the plan of care that was defined before. And then we have one anesthesiologist. We define an anesthesiologist as the physician anesthetist, who is supervising 1, 2, 3 operating rooms. And there is one nurse anesthetist per patient anesthetized. This means that the anesthesiologist is not present during all the case, and the nurse anesthetist is taking in charge of the patient. So this means the anesthesia management as task for venous routes, perfusion, and all the data, all the monitoring data, we can use all the monitoring equipment. We have the airway management, we are intubating, we are extubating, we are taking care of the respiratory machine, and we are also maintaining the anesthesia. And when we are referring to that, it's we have a role in autonomy, and for an anesthesia is not just a single shot, but it needs continually some re-injections of drugs or change the concentrations of some narcotics and so on. So every time we are deciding about the time for re-injection because there is duration of the, we are depending on the time of the surgery, depending also on the data we can get and to see if the patient has pain or not. And this is decided by the nurse anesthetist alone, and there is no prescription. So if we look at the real situation, it would be supposed that for every time we are doing a re-injection, we were supposed to have a written prescription for that. In intensive care, for example, you will have a written prescription for that. We don't have any. And nobody can prescribe in advance for an anesthesia plan, telling in 10 minutes, you will inject this drug, in 15 minutes, this one. It's not possible. So you have to adapt it to the situation. This means a continuing also assessment of the patient situations. And also we have to adapt to the times of surgery and to anticipate also for the pain after the surgery. Next, please. So in conclusion, a nurse anesthetist has an advanced knowledge in practice beyond the general care nurse. There is a lot of autonomy in assessment, anticipations, and corrective actions. Because in anesthesia is a special medical situation. This is not a pathologic situation. We are not curing anyone with anesthesia, but we are helping the patients to stand the surgery. So we are more in a physiological status as we are trying to balance. And this is the reason why we are more in corrective actions, in anticipations, than in curing actions. There is also an expertise in anesthesia management, in pain control, and also in resuscitations. We are very often considered as resource person in airway management or difficult venous punctures and pain management in the hospital, in the other wards. And also it concerns also the patient safety, because by our continuing presence during all the procedure, the patient is safe, and we can guarantee that there is someone qualified in anesthesia during all the case. So there is no need for an emergency situation. We can anticipate and we can provide safety. Next, please. So in many documents, until now, we are speaking even for nurses about task shifting, like something that will be coming from the high level, from the physicians. And this is something that we have to forget now. It's not task shifting anymore. We have to look much more at task sharing. And this is how I would like to conclude my, my presentation. Thank you.
Well done, Pascal, and thank you so much for your elaboration. I think this would be worth a full evening discussions, and you did it only in 5 minutes. In my friend's relation, there's also a nurse anesthetist, and then my mother of my well, the elderly said, "Well, what you're really doing? Can you say?" And say, "Well, I help people alive when they are under operation. Just keep them alive, and then in the thin line, not to make them deep sleep." So there's extremely very balance in your profession. Thank you very much. Next, I want to introduce Ilaria de Barbieri. So yesterday I was in evening dinner with Maya. We talked about health. I said, "Well, what would your..."
There were other people there as well.
Oh.
I tried to be there, but they told me you are not invited.
Yeah. Yeah, they were accompanying us. No. It was a big event, and everyone's.
So ready.
Yeah. Okay. Well, I feel good. So that's what they said. What would your catch be? I said, "Well, I would like to next time that Daniela from the Advanced Nurse Practitioners, the World Organization, the anesthesia, but also on the dialysis would be here in this room, because we have only one nurse, and that's far too small. So it's really important to have your voices, what you're saying, Daniela, Pascal, and everyone, just also in these rooms. And also Ilaria de Barbieri, she couldn't be here, and she sent a 2 minutes video message. Just I hope the sound works. One more click. Yeah.
The sound.
There's no sound.
Put the
Yeah,
microphone.
okay, I'll do it. I do it with mine.
Good afternoon, gentlemen, colleagues, and distinguished members.
No, sorry.
My name is Ilaria De Barbieri. I'm a nurse. I am the current president of ESNO.
Increase sound
It's
on
muted.
your left.
And I'm very happy to have the opportunity to send you a message. Good afternoon, ladies and gentlemen, distinguished guests, distinguished colleagues, and distinguished members of the European Parliament. My name is Ilaria De Barbieri. I'm a nurse. I am the current president of EDTNA ERCA, the European Dialysis Transplant Nurse Association, European Renal Care Association. First of all, I would like to thank ESNO for inviting me, and I'm very happy to have the opportunity to send you a message because unfortunately I cannot attend the meeting in Brussels. I'm here to represent the renal nurses across Europe, and the majority of them take care of people with end-stage kidney disease. That means that these people need a renal replacement therapy, the hemodialysis. I would like to highlight two main issues. First of all, the global shortage of nurses. And the WHO in 2022 estimated that the world needs an additional 9 million of nurses and midwives by the year 2030. And the 75 millions of people is suffering now currently in Europe from chronic kidney disease, with a projection that the chronic kidney disease will become the 5th cause of death by the year globally, by the year 2040. So my question is, in 2030, who will take care of people with kidney disease who require hemodialysis? And each day, consider that each day in Europe, about 30,000 dialysis treatments take place. And I would like to highlight that for a nurse working in hemodialysis is not just switch on and switch off the machine, the dialysis machine. It means specific skills that are learned with an additional post-basic course, post-basic education. And secondly, to be a renal nurse working in hemodialysis means to be fully in charge of the person with chronic kidney disease, which I remember I underlined that is a chronic disease. That means that can last 20 and more years. And even if you receive a transplantation, of course, the situation will get better. But anyway, the person needs a very long follow-up, needs to take medication, tests, examination. And so I hope that my points will be points of the discussion in the event, and I'm very sorry not to be part of the discussion, but I hope that this will raise a provocative discussion that is usually very useful. So thank you for your attention.
Thank you, Ilaria. I will send her a WhatsApp. And with the applause. Then I'll carry on to Catharina van Oostveen. And floor is yours.
Thank you, Bear. Good afternoon. Thank you for the opportunity to tell you today about how nurse practitioners contribute to the solutions in healthcare in the Netherlands and how the Dutch Professional Association for Nurses, Healthcare Assistants and nurse practitioners is committed to this cause. My name is Catharina van Oostveen and I am one of the board members of the Dutch Professional Association, VNVN. As you can see, this is not me on the picture. This is Inge Rinsema. Inge is one of our nurse practitioners and she is the chair of the nurse practitioner department of VNVN. It would be really nice, well, it would have been really nice to have her here, but I'm happy to represent her. Healthcare, next slide, please. Healthcare needs healthcare providers who align with the desire of many people to retain control over their own lives for as long as possible. The emphasis of the work of healthcare providers is less and less on treating disease alone and increasingly on staying healthy, functioning well, both physically and mentally, and coping with illness and limitations. Nurse practitioners add value to healthcare, both in general healthcare and in mental health care. They bridge nursing and medical treatments and are therefore well equipped to look at both the disease and the patient as a person in their context. This allows them to provide patient-centered care, focus on health, functioning and quality of life. There is a great body of literature indicating that the deployment of nurse practitioners contribute to 1, more efficient care through the provision of effective care at comparable or lower costs, and higher patient satisfaction compared to care provided by physicians. With the increasing focus on staying healthy, functioning well, both physically and mentally, and coping with illness and limitations, it is expected that these results will be even more convincing in the future. And therefore, our mission is that everyone in the Netherlands will have access to care from a nurse practitioner by 2030. One of the things we have done in pursuit of this mission is to release a documentary about the nurse practitioner. We want patients and future patients to become more familiar with the profession of nurse practitioners so that they receive the right care. Additionally, we want other healthcare professionals to understand what the profession entails and how they can relate to nurse practitioners so that nurse practitioners can practice their profession to the fullest extent. In parallel, we are working to secure 650 training spots for NPs per year to meet future demands. Next slide, please. The first nurse practitioners began master's level education in 1997 after introduction by the late Minister of Health, Els Borst. She foresaw that NPs could contribute to solving the increasing demand for care and the physician shortages, and she expected cost effectiveness of NP practices. Furthermore, she was convinced a university program for nurses was needed to improve their career perspectives and job satisfaction, and therefore was beneficial to nurse retention. Next slide, please. The NP role was officially introduced in 2009 in the Netherlands. Physicians were skeptical and were afraid NPs would block their training possibilities, and therefore, in order to authorize an expanded scope of practice for NPs, an innovative legal instrument, a time-limited law was introduced. This law granted NPs the official right to work in expanded roles for an initially defined time period of 5 years and was linked to a nationwide evaluation on safety, quality of care, efficiency, and costs. On average, for employers, the wage cost of a NP in training in the Netherlands are 60,000 euros. Half of these costs are subsidized by the Dutch Ministry of Education, Culture and Science. Next slide, please. After 7 years in 2018 and a lot of positive evaluations later, the NP's independent practice authority was established. So it was a huge milestone for them at that time. NPs are now authorized to independently indicate, perform and or delegate certain procedures according to the Dutch Healthcare Professions Act. These procedures must fall in the area of expertise in which NPs has been trained, must be of limited complexity, routinely performed and have manageable risks. And of course, the NP must be competent to carry out these procedures. This wide formulation of the Professions Act facilitates local agreements about what is complex and what is not, as the complexity depends on the context in which tasks are carried out and the frequency of occurrence of the tasks. Currently, there are approximately 5,000 certified NPs working in the Dutch healthcare system. We hope that by 2030, this number will be close to 10,000. For your comparison, we have 11,500 GPs for 1,700 million people in the Netherlands. Next slide, please. A strong position for NPs in the Dutch healthcare system is essential because we know it contributes to better patient outcomes and job satisfaction for nurse practitioners, and therefore leads to retention of nurses. From the Professional Association, we support this by, one, establishing a knowledge center where knowledge is developed and consolidated to underpin the practice of nurse practitioners. In total, we have 68 million euros allocated for the next 5 years to develop, disseminate, and implement knowledge. Two, we do that by collaborating with educational institutions to create programs that align with practice needs and working with employers to ensure the availability of career pathways for nurses to become a nurse practitioner. And three, by promoting autonomy by urging employers to allocate time for this, offering a leadership program for nurse practitioners, and recently a law has even been passed mandating the influence of healthcare professionals in healthcare institutions. So it goes without saying that we wholeheartedly support the ESNO Declaration. Thank you for your attention.
Thank you, Catharina. And we have a very, and with you, we have a lot of differentialities. So we have the Dutch, that's sometimes somebody, what I hear from you, you're traveling to the Netherlands, you talk about the Dutch example. There's no good and no bad, but it's really good to learn. So I think it's really a good opportunity in our organization and to starting this, to do some twining and just to learn from each other. When I was looking at you in the screen, I also see Elena Brioni. And I don't want to leave her out because she has been developing a nurse's guide how to read scientific articles. I know you're not so well in speaking, but I really want to give a big applause for your work, what you did. It's also translated in French. And that's also a bit of a reason because everyone is talking about science data, but how do you read it? How do you get along with it? And instead of being scared, so she created a guide, what makes people more comfortable, but also more interested. So I want to give a big applause to Elena. Okay. We have left a bit the nursing domain. Now we are going to ask Harrietta. Harrietta is the project leader of the UVECA. And if I look at the time, we're still safe. So, but it's good if we are still safe, then we have still time for some questions. She's leading a project and we are as nurses involved in it. And why it's so important, there's so many new projects going on. And it's really good to have the nurses involved. And the persons who are involved are only still a bit too few. So there's a great opportunities also in your program to have nurses more engaged. So please, the floor is yours. And my question is also just speed up.
No problem. Thank you for inviting the UVECA project to this event. Just to say, I'm not a nurse. I'm not even a healthcare professional. So I'm a bit like an alien here today, I think. I'm a project manager and have been leading projects, European projects in the healthcare sector for many years. So I'm a kind of ad hoc expert, or I know a bit at least. So I'm here to talk about the UVECA project. And in the UVECA project, next slide, please. It's an Erasmus Plus project, so one of these centers of vocational excellence. And in the UVECA project, identified 6 megatrends that we are working with. So the overall objective is that we know that the healthcare sector is, you said it, Maya, very well, that we need to do something if we want to keep it sustainable. And we have identified 6 megatrends that we are working with in the project. So these are, for example, the aging population, the chronic diseases, or the digitalization, the personalized medicine, and this what we call the modern and competent health consumer. And then, of course, the very big role that the healthcare sector also plays within climate and energy and so on. And we think that we need to do something about the education in all these 6 megatrends, because it all gives new challenges to the healthcare professionals. So we are not only working with nurses, we're working with also doctors and physicians and so on in the project. Next slide, please. And you were also talking about data. So we have in the first part of our project made a baseline report where we have asked almost 4,000 healthcare students and healthcare professionals what they think about these megatrends and the 21st century skills. And based on the information that they have given us, we are going to develop, you can skip the next slide and go to the next again, because I am in a hurry and it doesn't look good neither, the slide, so that's fine. We are going to develop a European VET platform where we will develop all kinds of training activities and innovation activities. For example, I was very inspired by this Invisible Nurses, because we are also planning to make some innovation workshops where it's possible for nurses or other healthcare professionals to develop and innovate together. But we are right now in the phase of developing so in the first place, the technical platform, and then also all the content of the platform, which will be divided into these 6 megatrends that we were talking about. So like e-learning courses, webinars, problem-based learning in all these six megatrends, which will be available for either students or also professionals and educators in the sector. Beneath this European platform, we are working with 7 regions that are all developing like hubs in their regions, where they are working together. So healthcare providers and healthcare educational providers to agree upon how they can actually do things on a regional level in order to break down some of the silos that we really need to break down. We are talking so much about breaking down the silos in the healthcare sector, but we also need to break down the silos in the healthcare educational sector in order to reach the needs of the healthcare sector. So this is very important discussions going on regional level on how they can actually find out to do things on a more flexible basis. For example, internships for nurses within the engineer education, so that they can learn each other better and things like that. So I was trying to be quick. So the last slide, if you want to keep tuned, I don't know what has happened with the slides. It looks a bit strange, but we have a website. Yeah, very interesting. I don't know where it comes from, but you can keep in contact with us on eureka.eu. I think that's quite easy to remember. So if you want to keep in contact with us, you can do it through our website. Thank you.
Thank you very much. And there's also another project. It's called the Be Well, And both organizations are going to start a consultations process. So it will be very interesting over time just to be in that you also can contribute to the consultations, because they make a big framework. And then it's time just to have all this input. And it's really important to contribute to this, as also having data, having expressed, because it doesn't work if you're not there. It's unlikely they see you, and if you don't speak up, it's very unlikely they hear you. The floor is now to Josephine, and I'd like to explain that Josephine is our appointed junior policy officer, and also that she's one of the examples of many nurses of us, and we need to express this also to the wider public. Most of us did a night shift or a weekend shift to create free time to come, because they are not supported by their institute just to come. Even I have to write institutes and send invites and ask them just to come. And it's also one of the bullet points in the declaration. Josephine is going to say some passions.
Oh, perfect. Then it's perfect. Yes. So
yeah.
So, ladies and gentlemen, and I think this is one of the first time as I have so many colleagues in the room with the European bubble. So, dear colleague, it's really a pleasure to see all of you. So, I'm Josephine, like Bear said, no news for that. I'm going to take you in the next few minutes on a journey, the Nurses Pool journey. This is an initiative for ESNO, and it's a quite straightforward approach to mix and to give the voices for nurses and the survey, and there's a platform when we can mix each other. So it's really an opportunity to post survey, but also to raise your voice. Once you've set your profile on it, you'll receive access to a survey that aligns with your expertise. You can go 2 slides later so that you can have the platforms. It's kind of a place where both data and narrative can meet, shaping a whole healthcare landscape. And they can come together so we can have like proper materials, like we said. But why? Why do we need this initiative? Why do we need this? Like Maya said, we need data. Like you said, we now know how to read data with this guide of evidence base. So in today's world, we have so much data, but we often lack specific data, comprehensive data regarding the working condition of our nursing workforce. As policymaker, you understand the gravity of making informed decisions. Imagine crafting effective healthcare policy without understanding the challenges nurses face daily. The Nurses Pool addresses these critical needs by collecting accurate data on our nursing professional. And on this journey, we're also cultivating a community of nurses. And it's really a key to this project. This community lies at the core of our initiative. Our platform is all about the story that influences policy. It's about individuals like Ilaria, Alessandro, Daniela, everyone, and their colleagues uniting to advocate for change. Consider the power of this united nursing community, sharing their perspective, their experience, their view, their reality in a structured manner. It's not just from some random. It's a place where one can ask survey, one can fill out, and we can provide data. That is like. Through this approach, we foster empathy and understanding the foundation of effective policymaking. While our community is growing, we aspire to have even more nurses to join. So I take this opportunity to reach out to your phone and to register. You will receive a link by mail afterwards. So we need you to share the link, to give your voice, to raise your voice. You're here, it's good, but we need to go further. As nurses, this place is the place to go and raise your voice. As policymaker, this place offers opportunity not only to access valuable data, but also to propose survey, engage directly with the nursing community, fostering collaboration and innovation in healthcare policy. This is a work in progress, a testament of our commitment to improve healthcare data through data and storytelling. While we're not where we want to be in terms of participation, that's why I'm asking you to join more and more. We're moving forward with determination and driven by stories, our patient's story, our colleague's story, our loved one, your story. Everyone shared a story before. In conclusion, this is really an opportunity for everyone. So really invite you to join and to support us in this platform. Thank you, Ben, and everyone.
Yeah, and I think Joe, because she's one of the passionate leaders of creating this nurse pool. So it's www.esnonursingpool.eu. Get connected and see that there are another 1,000 nurses got connected. And that also was Maya, who was there about 1.5 years ago when we initiated this plan. A year later, we had this operational, and in 12 May, we launched it officially. So thank you. We have a few, we are great in time. I would like to now invite Adriano for two things. Well, it's first of all to open to launch the declaration. You have a surprise because you want to say something about fellowship, yeah? And you're going to do this in 5 minutes. And then we really are very close to wrapping up time. And I'm really curious to hear Istvan views. But first, you're going to say something about the fellowship and the declaration. The floor is yours.
What we will do first, fellowship or declaration? Fellowship. Okay, I will call Alessandro. He's the chair of the fellowship program. All right. So we cannot read anymore. Okay. We started with a fellowship program, and now we will give the first fellowship awards. Alessandro is the president of the committee.
So, good afternoon, everybody. And we are launching this fellowship award of European Specialist Nurses Organization as a new initiative that's going to be launched today, but it will continue in the next years officially. You can follow how to apply in our website. And but today it's a great day for us. Nursing. So we would like to have 2 honorary fellowship. This will be the first fellowship. The first one is for the member of Parliament Istvan. I
just realized my name there. I didn't know it.
Yeah. We want to thank you for hosting this event.
Every week you can be more.
Future cooperation. And yes, you will get one of the first fellowship awards from the
And the second one is for Maya Matthews, that she's always helping us in all our initiatives.
Maya is a big friend of the ESNO. Well deserved.
I look forward to seeing all the games in the future.
Yeah, thank you very much.
one is also for our treasurer and president, Alessandro.
I would like to call our chief executive officer. Per Omen, who is the machine and the engine of this organization. Thank you so much, Per. And
well, he forbade to tell about him, but
yeah,
he's great. I would call Christine Willems, who's part
of the ESNO board, and she's well experienced advanced practice nurse.
Very old member of ESNO to represent ESNO. So thank you very much.
Just don't.
Thank you for listening to us now.
Yes, I will go back. I think there is highly stressed. We are on time. I need a few minutes. Well, this is ESNO declaration, 10 recommendations to enhance the role of specialist nurses and advanced level in European healthcare towards 2030. The first, enhance specialist nurses' professional education and promote continuing professional development to improve staff retention and ensure the delivery of qualitative care. Develop a harmonized framework for recognition of certificates, level of autonomy, diplomas and degrees in the European Union for the healthcare workforce to facilitate seamless mobility and ensure consistent standards across member states. More specifically, establish a European framework for automatic recognition of specialist nursing qualifications to streamline the recognition process and ensure consistent standards across member states. Improve financial conditions for nurses by offering competitive salaries and benefits that reflect their competencies, knowledge, skills, and contributions to patient care. Create positive and supportive work environments by ensuring reasonable workloads, manageable shift schedules, and safety at work requirements to prevent burnout and job dissatisfaction. Provide clear career pathways and opportunities for professional growth to attract and retain specialist nurses in the healthcare workforce. Offer financial assistance, relocation support, and competitive compensation packages to address financial consideration and promote effective professional engagement in health programs. Integrate critical education and training programs on green, digital, and microbiology awareness into healthcare curricula to promote sustainability and professional literacy in the sector. Harmonize prescribing practice, formal and informal, and educational standards for nurses across the EU to optimize patient care and recognize the expanding role of nurses in pharmaceutical healthcare delivery. And at the end, foster interdisciplinary collaboration among healthcare professionals through shared decision-making, clear communication channels, and opportunities for interdisciplinary education and training. After this event, you can sign this declaration on our website. It will be open. Thank you very much, and thank you for being here.
Thank you. Istvan, the last words. Thank you.
The last words only today, I hope. I have so many questions. This is the problem. Go ahead. No, we don't have time, but I think you have to know that I have two main issues, topics. I'm first vice chair of the Transportation and Tourism Committee, and I'm the leader of the tourism lobby in the European bubble. It's my old job. I was responsible for tourism in the Hungarian government 16 years ago, and I'm still in the tourist family. And the other one, of course, the house. And we have the same problem. It's a service, and we don't have enough colleagues, staffs. So always my question, it's important to have better and better education system, skills, good education platforms, but who will be our students? Because I just heard that in Hungary there is a relatively famous nurse school where in the past every year they were 100, 150 new students. And now this year they started with 15 because nobody would like to join it. So I think this is our biggest challenge because of course we have to give better salary workforce for all the nurses and medical colleagues, but maybe it's not enough. We miss something else, something more. We need a campaign from, for example, your European level, on TikTok and on the new platforms. We have to make a campaign. Join us, serve the people. You will be our next hero. Yes, because those people, the 14, 15, 16 years old, my daughters, maybe there they will realize how important it is to serve the health society and the industry and the people. So I think there are lots of things to do. Thank you so much having you here. And I hope we can meet. Not the next week because I have to be in Beijing, but maybe after that we can meet again. Maya, there. Thank you so much, Mr. President. And also it's my pleasure to get this.
Well, thank you all, and I really appreciate everyone who was there. So then I also see Corinne Skikluna. I'm really pleased that you're joining in. Jasmine, I closely know all of you, but it's also what I would like to see you, Maya, that you're going to remember all these people. So in the future, you're not going to see me, but we also see, because the relation of advanced nurse practitioners, she's also one of the leading persons in Malta. And also, so there's so much to learn. We're going to wrap up. Take your things, don't leave things behind. And we hope to meet you at the Quartier Leopold, because that's where we're going to have a drink. Thank you again. And also thank you.
Photo. Don't forget photo.
Okay. Oh yeah, we are going to have a photo. And thank you for all the listeners at home joining this event. Thank you very much. Bye-bye.
Thank you Beth, for moderating the session. Not so easy to us.
Yeah. Yeah, it's always difficult when people tell you, be short. Then, oh, you remember me. Oui, merci d'avoir participé.
Ah, c'était riche, c'était intéressant. J'ai dû partir parce que j'avais un souci, mais on va continuer, on va continuer.
Oui, ça.